Guys, it's Swetha, your host. It's been a while since we came online, and we are back with a new conversation series of some of the most exciting people that I've met. And today we have a very special guest with us. He's a gynecologist from Chennai, and he's also the host of a Spotify podcast called the GSpot, which focuses on women's reproductive health, sexual education, and much more. So, welcome, Dr. Arvind. It's a pleasure having you here. Thanks for being our guest tonight. So,
Thank you so much for having me, Dr. Swetha. I'm quite happy to that. You have started something very soon in your residency, and I hope that it'll go well. And let's have fun.
Thank you. Thank you so much. So, let's start jamming. And so, the first question for you is, what was it? What was the difference between your residency days and now that you are a practitioner? What is it being like being a guy, being the gynecologist? So we'll start there.
Yeah. So, firstly, I will tell that I have not started practicing too deeply into OB-GYN right now.
Okay.
So, thing is, I have a friend. He just told me this yesterday. Like he has done his general medicine, and now he's chilling. He's reading novels, and he's writing a novel himself. So, what he told yesterday to me was, "I want to normalize taking a break." So I think it is about time that doctors in India, as well as people who like follow very rigorous, like college programs, don't hesitate to take a break once in a while. So I have been on something like a sabbatical. So I have like started working for the government now. So I have a day job, and once that is over, I'm not keen on practicing now for the next, I think, next for a few months, and then in the meantime, I'm trying to do whatever I want to and miss out on all the excitement, on all the activities I missed out in medical school, medical college, and in residency. So that is what I'm doing right now. Planning to go into hardcore OB-GYN practice in a few months. But I should say that being a male OB-GYN is not a very new thing in India per se, because most of the textbooks of OB-GYN are by Indian authors, actually by male gynecologists. So there have been a lot of good male gynecologists in India, and they still are. I mean, like maybe because Tamil Nadu doesn't have as many male gynecs, it might look like something like pegging a stereotype. But if you go to Kerala, or even if you go to North India, there are quite a lot of male gynecs, and it's not something which is like very new. It's something which is actually quite existing, and maybe it's making a comeback in the recent few years. I can say that.
Okay, great. So, so your podcast, the GSpot, can you describe what it is actually about?
Yeah. So I did not per se want to start a podcast. So my ultimate goal was to have a media where I'm comfortable talking about things, and a media where it is comfortable for me to convey information to the masses. So I had to plan what I wanted to do. So I had to find out what my target audience was. So my target audience is usually people who are in their 20s and 30s. Some of them are in their late teens, and some of them are in their 40s, but most of my audiences are in the 20s and 30s. So the people who are in 20s and 30s are actually active most on social media, and especially on Instagram. So I had to like spend my time creating posts for Instagram, and I felt that Instagram doesn't quite cut it. And I don't believe in making short reels or like posts, because they don't communicate as much. And there is this particular phenomena wherein researchers have found that Instagram and TikTok, basically that reels and TikTok have actually like shortened the attention spans. And I really feel that I can't compress very important information in a 60-second video, and I don't think it does justice. And the next option would be was to go to YouTube. And again, YouTube is something which is both visual and audio. So people have to spend time to look at a video and not do anything else. It's very hard to do to watch a YouTube video and do something else, multitask. The best option for me was to do a podcast, because it's an audio based media wherein the listener can do whatever he or she wants to. They can be driving a car, they can be cooking, they can be doing a workout, doesn't matter. They can just keep listening to whatever they want to. And podcast actually is not a very recent phenomenon. It has been there for almost 2 decades. So it has been making a storm. It's creating a storm in India right now, but it's been going on for a while. And I actually had this attachment with podcast because I used to listen to them when I was my final MBBS. I used to have some very nice podcasts, but then none of them were Indian podcasts. They are basically podcasts which are based in the US or in the UK. And there are some of them which are actually very nice. And there is this one particular podcast called the Weird Medicine Podcast, which has a modern medicine doctor and a Chinese traditional doctor talking about stuff. It is actually a very adult version of a podcast because it's not for kids basically, but it was a nice introduction to what a podcast can be. So you can just talk for minutes to hours and people will listen whatever they want to. Right. So that was what I wanted to make a podcast for. And the next thing is, when I started making a podcast, it's actually a journey. So I feel that I started it to be something only to talk about women's health and reproductive issues and all. But I found it is not I found that I'm restricting myself by confining in between with those terms. And I felt that it is just another way of expressing myself. And why should I constrict myself when I'm expressing myself? And I thought, okay, I'll touch about things which I really like to talk about. So maybe in the next season of the G-Spot might have a new name. I'm not sure. I'm just thinking about it. But a name which encompasses a lot of other things, not just about reproductive rights and women's health per se, more about health and science, something like that.
So, guys, I've listened to the GSpot and I found it really interesting. Some of the things that, basically goes on flitting in most of our minds. And thank you, Dr. Arvindh, for bringing it into a platform where it is accessible for most of us. And I wish you best luck in expanding your podcast and, your future endeavors. So
thank you so much.
Yeah, so we'll skip to the next question. These days, marriages face a lot of issues. So one of the most important issue that most of these modern marriages face is sexual incompatibility. So how do you think how important do you think is sexual education before marriage? Do you think what exactly do you think should people consult a gynecologist about before getting married? And should people actually consult a gynecologist about how to do it? So what is your take on that?
Yeah, so thing is, marriages are something different for, like, a marriage is a different thing for different people. So when you have when you take a particular marriage, it's about how do people interact with each other. And what I feel is, and actually it also holds true for my marriage, communication is a very important aspect. And unless and until people start to communicate, they won't know what they are getting into. And when you talk about sex in any relationship, it is going to take a lot of comfort for both these people to be with each other to talk about sex or even indulge in any sexual activity. So unless and until they have been in any sort of relationship, something like a friendship or in a relationship before they get married, or even in the early part of marriages, you can actually, like, if it's an arranged marriage, you can't expect every marriage to have a few years the girl or the boy knows each other, right? So even in early steps of marriage, it is better that they don't get into the act immediately, and they spend some time communicating and setting boundaries, and like putting down rules and what they want and what they feel is comfortable. And like a very important thing which I think few sexual educators on Instagram do talk about it, right? It is about communicating and consent. And thing is, it's not what you see in the movies or in porn. Sex is not what you see in the movies or porn. And you can't find that, you can't no, like, it doesn't work on the first time. It doesn't work on the first time at all. So you need to have a long you need to have an understanding with your body, with yourself, and then you need to understand what your partner wants and what your partner is comfortable with. Discuss what works for you, because one position will work for one partner and the other won't. So you need to communicate, and it's okay if one person orgasms and the other doesn't, because both people orgasming at the same time is not very highly statistical probability. It happens only around some 5-10% of the times. So it is okay if one person orgasms. The important part is you don't you respect the other person, that you also make sure that the other person gets an orgasm or like has some satisfaction over a period of time. It's not if just one person gets satisfied, the other person does not get satisfied for a long period of time. That is what like is going to bring in some amount of problem. So you just try to work and communicate things out, and it is and if people are experimental, you can even bring in help in the form of toys.
Okay.
Right. And there are many other ways to know, like, to improve your mood and improve your sex life. It's not just sexual activity per se. There's a lot of things, starting from the setting the mood. Like, you need to make sure that you know, like, you both of you are in a safe place, a safe zone, and that both of you are not like stressed out, and both of you have a proper understanding of each other and what is going to happen. And then you relax and you do whatever you want to. It does not even have to end in intercourse. It can even just be like hugging or cuddling or kissing, and it can end with that. There's nothing wrong in that. People need to understand that sex is not an activity. It is something which you do out of pleasure and out of love for your partner and for yourself. So communication is the key. That is what I would like to say in this.
Yeah, so beautifully explained.
And about talking to a gynecologist, gynecologists are it's like, yeah, you can talk to a gynecologist, but the thing is, like, again, gynecologist is going to be a third person there. So unless and until you are comfortable with the gynecologist, you are not going to be able to talk about sex to the gynecologist as well, because any other patient who comes to the gyne clinic, they don't open up about sex in the first attempt. It's going to take them a few visits to the gynecologist to get them comfortable with the gynecologist to talk about sex and their sex life. So if you have a gynecologist whom you are comfortable with, you can very well talk to them. Or else, if you don't, I suggest you find gynecologists who are in your locality and, like, try to go talk to them, find out which gynecologist is the most suitable for you, and then you stick to them for a long time.
Okay. So moving on, there are a lot of lot of diverse population in our country now. So there are like trans people, there are gender fluid people, non-binary people, and a lot of other populations than we see about the normal male and female genders that we usually encounter. So what is your role as a gynecologist in providing care for such people? And what do you think will be the common problems that they encounter?
Yeah, so the first problem is they don't know where to go to. See, it's like there are a few trans influencers who are from India, online and Instagram and social media, but they are the creamiest of the cream. So they are people whose parents have accepted them being trans or them coming out as non-binary, and they are like, there are people who have been able to spend money to get surgeries done or to get hormonal treatments done, right? And see, and they themselves have had a lot of trouble in the entire process of them coming out or like doing a transition from one gender to another, right? So in that situation, they are not even the top 0.001%. So there's a lot of people who are trans or who are non-binary in the country who are not able to even come out of it. They're not even able to tell it to someone else other than themselves that they are so and so. So first and the most difficult thing is to find people whom they can communicate with, and then to find a doctor whom they can communicate this with. And as you said, like, there's a lot of role for gynecologists in this particular aspect. So I have a personal interest in cosmetic gynecology, and my wife is actually trying to, like, getting into plastic surgery right now. So there's a lot of interest about plastic surgery as well. So there is a lot of difficulty in these what to say, like, surgeries for people who are trans or who want to change gender. And even there's a lot of problems in the hormonal therapy. It's not that cheap. It's quite dangerous. it has side effects, and it depends, because we need to understand that it is not just something which they identify with. There are people who have some amount of genital abnormalities because of their particular chromosomal diseases or some other hormonal diseases. So there are people like that, and there are people who identify themselves as something which they are not. So we need to start basically with a very good counseling session. They need to be counseled. They need to be understood of what they have gone through. If they have any other associated conditions which requires therapy, like the depression or whatnot, that has to be like addressed as well, and that has to be addressed in the beginning, and then we start with the therapy for like conversion and stuff like that. But the basic thing is we need to set up more efficient and more safe zones for people who are trans and who are non-binary to come up and to come out and get treatment. And that is what I think is very important in the country right now.
Exactly. Very well explained. So speaking about cosmetic gynecology, can you elaborate more on that? Because for a layman, the basic idea of a gynecologist is dealing with pregnancy, but you guys do go and do a lot more than that. So what is the status of cosmetic gynecology, especially in India? What is the awareness level among people here? And what kind of procedures are you commonly referred for regarding cosmetic gynecology?
Yeah, so cosmetic gynecology is something which I want to do in the future. I'm just starting up right now. But what it is basically any gynecological procedure which involves in making private parts of a woman more acceptable for her. So it can be either complete plastic surgery for a cosmetic purpose, but most often it is actually a functional therapy. It is actually treatment which actually gives a lot of functional betterments and improves the quality of life for the women as well. So I have a episode with Dr. Swethha, who's also a cosmetic gynecologist, who actually look up to for cosmetic gynecology, and like he quotes it that way. Like he quotes it that it's actually a functional gynecology more than cosmetic gynecology, which actually is quite true, because the procedures which are commonly done are going to be something like a vaginoplasty or a perineoplasty or a hymenoplasty and labioplasty. These are the four basic surgeries which are being done. So what happens here is, for vaginoplasty and perineoplasty, these are surgeries which actually try to improve the support of the vagina and the muscles surrounding the vagina. Right. So what happens is, it is actually going to improve the cosmetic appearance of the vagina and the perineum as well. But the most important thing is, it actually helps in the women to have better sexual activity, and this also solves a certain amount of something called as a stress and urinary incontinence. As in, like, women who have actually had a few deliveries know that when they sneeze, they actually drip a few drops of urine. So that happens with normal delivery, whatever type of delivery you had, like normal vaginal delivery, or if you had any instrumental deliveries or whatever, it will happen to someone who has had a normal delivery, maybe one or two deliveries over a period of time. So when this happens, this is going to be very stressful for them, because like they'll try to cross their legs when they cough or sneeze, or this actually get aggravated towards menopausal age. So when you do these procedures, people who have certain diseases like this, which are like going to affect their quality of life, will actually improve. So that is there. But the general perception for cosmetic gynecology as such is, in India, people are not that aware. The layman are not that aware. Doctors actually quite know about it. And what is usually advertised is about hymenoplasty. That is what is quite advertised, because it is something which people think you do that before, if you are sexually active before your marriage, and then you want to go into a marriage, it's an arranged marriage or something of that sort, and you want people to think that you're a virgin, and you get a hymenoplasty. That is not how it works. Hymenoplasty is actually a procedure which which is usually used for that purpose, but actually some studies have told that it actually improves a little bit of sexual activity, like sexual experiences as well. And we all know that hymen is actually a very elastic structure. So it does not mean that if a woman who has hymen which is not intact is like sexually active, she may have not had sex. It would have been her normal anatomy, or it could have been that she had been working out, or she had been stretching or doing yoga, or she had an injury or something of that sort. It can actually tear it. So there's no single definition for an intact hymen in the text. We have various images of normal hymens. So that is actually a very wrong concept. So that actually is actually the reason why we have the Supreme Court in India has actually banned the so-called test for virginity. So doctors are not supposed to do this so-called test for virginity because it is not true. It does not imply that the person is virgin or not. Just because you see a hymen or you see that the vagina allows one or two fingers. That's not how that, it does not work that way, right? So I think we need to understand that cosmetic gynecology is more than just what a beautiful vulva looks. And I think it is going to affect the Indian population a lot, because I feel Indian population and Indian people mirror a lot of people in the US. So currently, labiaplasties actually are are done in a very high number in the US, and that is actually due to a lot of inspiration from seeing porn sites and like OnlyFans and like all other, because you can actually see a highly sexualized content even in your normal movies. So when you look at that and you want to be like that particular actress, it is a psychological effect which brings people to the plastic surgeon asking for surgery to look like that, right? So this is going to be something which is more common in the future, but I think we need to understand this is more of a functional aspect towards pelvic health than a cosmetic aspect as well.
So on a scale of 1 to 10, how popular in India do you think is this procedure? Like how many people actually come for this procedure on a scale of 1 to 10?
Yeah, so I have not done this as much, so I am not very sure about the exact scale, because this is actually a very hush thing. Okay. People usually don't go about and tell that I got my hymenoplasty, right? So we don't have studies in India to tell that okay, this is how many studies we have done. In the US, we have studies because women are quite open about telling that they had this and they had done to a medical researcher. Not to our partner, but then to a medical researcher. But then like that does not work in India. We don't for one, we don't have people who do as much of research here compared to the US, and people are not that open to talk about sexual health even to their gynecologist. So it's not that it's not out there for us to find out how many people come and ask for the surgery.
Okay. So moving on, we are seeing a lot of infertility issues, PCOS on the rise these days. Compared to olden days, there's a lot of PCOS and infertility. So what actually do you think is a causative factor? Are women not really serious about these issues just because it's becoming so common? Or what else in their lifestyle habits do you think is causing this? And what detrimental effects do you think will it have on their general health?
See, PCOS is actually it's not that it's more common now. It's like we are diagnosing it more now, right? Women have had PCOS for a long time, and the thing is like the mild cases of PCOS in the past have not been diagnosed because you need an ultrasound which is very good, and you need to have lab tests which are quite accurate. The first case which was actually of PCOS which was documented in medical history was actually of a woman who had severe hirsutism. That is like she had facial hair and she had infertility. That is actually the most severe extent of the PCOS patient. So you have various levels of like this is a very big spectrum where the patient can be anywhere in this, right? So there is actually the thing is PCOS is actually a multifactorial disorder. So there's not one particular cause for that. But the most important factor in PCOS is going to be insulin resistance. Okay, so insulin resistance is what is going to trigger a lot of the chain reactions, which ultimately leads to PCOS and infertility. Okay. So the most important factor for a person getting insulin resistance is going to be two things: obesity and decreased physical activity. And that is actually very, very common in our current situation. In our scenario, people are actually getting a lot of like highly calorie dense foods, and that actually leads to obesity. And we are not exercising as much as before. So we don't work out, we don't take care of your health. That is going to cause a lot of PCOS also. And there is also a form of PCOS called lean PCOS. So in this, the patient is actually quite lean, but then they still have the PCOS because there's a genetic component of it. So there's a lot of like it's actually an evolving disease. So the best way to treat PCOS is to treat PCOS if it is going to cause a problem. So if you are having infertility because PCOS, or if you are having obesity and you're having PCOS, or if you are like having insulin resistance and you're having PCOS, you can treat it. Otherwise, PCOS is going to be found or diagnosed in almost 10% of the women anywhere. So if you have 10 women, one of them is going to have PCOS, and they might be completely normal with that. They might be completely normal. They don't have any problems with that. They might have a little bit of mild menstrual symptoms, or like they'll have a like prolonged periods or delayed periods or something like that, which is not going to be much of an issue for that particular person. If it is regular, or if it is like, if it's a little bit irregular, it's okay. But then if it's too irregular, it's going to be a problem for them, right? So it is going to be an issue only if you are bothered with the symptoms of it, like infertility or so on, or obesity or so and such. Otherwise, you can actually wait and you can like try. You can actually you can actually conceive normally with PCOS. Not that if you have PCOS, you're not going to conceive at all. It's not like that, because 10% of the women will have PCOS and they will actually have fertility. They are not. It's not like they're infertile. They will have fertility. Sometimes their fertility range will be comparatively little bit lower compared to the normal person. That is it. Otherwise, you don't have to like aggressively treat PCOS. The best thing any doctor will tell is to have a healthy lifestyle, to have a healthy diet, to have a at least have a decent workout plan, that you work out at least twice or thrice a week for 30 minutes or so that you have a healthy body with yourself. That is going to be sufficient for almost every chronic disease for that matter, not just PCOS.
Okay. So we'll have something for the men also, treating men versus women. So who do you find treating men or women difficult? Who do you find more difficult? And who do you think have a lot of issues that are common and and are not being addressed? Is it the women or is it the men?
So this is actually a very nice question. The thing is, being a man, I would like to tell that men have to be represented in certain places where they are not, right? So I'll give you an example. So when I was doing my residency, right, usually what happens is when we are in our labor ward postings, so where we work in the labor room for we work there for around 3 months and then a stretch for a year. So it'll be a 12-hour shift, and like every time we have to do something for a patient, like whether we are going to like try induce labor, or whether you are going to take the patient for emergency C-section or something like that, we'll have to get consent, right? And in case it is going to be a very it's going to be a thing like emergency LSC, so it's going to be a high risk surgery, something which is like a complication of an LSC or something like that sort. I would actually prefer to get a consent from the husband, right? So actually, like the thing is, the consent of the patient is sufficient. There's no need to get a consent of the husband or anyone else. But we usually inform the family members of the patient, and then we also get a consent from the family members as well, right? So in that aspect, I usually talk to the husband, because men are more stable emotionally at certain times. So when it is something to that person's wife, I've seen that husbands are more calmer and they're more composed, and they receive what I'm going to tell them, and they understand what I'm going to tell them, and then they respond to it accordingly. What happens most often is the mother or the mother-in-law, they tend to take it and they get to complicate things, and they tend to overthink things, and it leads to a lot of chaos at times, right? So when it comes to the father or the husband, they are like very clear, like, okay, this is what you want to do, go ahead or don't do it. it's clear. It's either this or that. There's not much. I mean, there are guys who do confuse a little bit, but then like it's not much, right? So that is what I want to tell about that. But thing is, men have issues as well, and so what I felt is, see, there's a history of feminist movement having four waves. So the feminist movement has actually had four waves. The first wave is actually in the 1950s and 60s, which made women equal and gave them voting rights. So that is when women were actually like legally conferred rights compared to the men, and they were given voting rights, which is the most important right any person can have. Second wave was actually in the 60s and 70s, which talked about sexual freedom and reproductive rights, right? The third was about economic and gender pay gap and workplace inequalities. And we are currently in the fourth, which is which is technically supposed to start from 2010 and 2012. Okay. So what has happened is, what I feel and what many people also feel is, the last wave of feminism has not been very kind towards men. It's been very abusive towards men in certain aspects, right? And the thing is, like, when you talk about feminism, you talk about equality about every gender. So there is no way you can, there's no way you can solve a conflict by berating another person, or like not involving the other person in the discussion. So you can't stop a war by just talking with yourself, right? When you have a question, you need to talk to the person who is also talk to the enemy as well. And thing is, I want people to understand that the enemy is not going to be man or the male gender. The enemy is going to be people who are against feminism, and that can be anyone. That can be a man, that can be a woman, that can be who are trans, some people who are trans. And when you understand that concept, you start hating men, and you accept that there are people who are actually going to help you out, right? So I think that is going to, and because like I see that, because I know patients who are guys who don't speak out because they think, okay, this is going to offend women, this is going to have me they're going to talk bad about me, they might like block my account, they might cancel me. So this is something which is actually happening in the Western countries, and I'm pretty sure it's going to come to India as well. See, because like we are we are mirroring the US and the UK in almost every single thing. So our economy is mirroring them. So we are having startups booming as much as the US now. So like we are completely copying what the US is doing. And that is not a very good thing, because the US is actually in a very big crisis and they don't understand that themselves. Right. So when we try to copy a nation, and like when we implement things from some people, because we are culturally impressed by them, it's going to lead to a lot of problems. Because like we have a very different problem in India. Like because feminist issues there are different than feminist issues here. We are still fighting for making sure that marital rape does not happen. We are still fighting so that women have rights even after their marriages. So we are still we are fighting for infant feticide, female feticide, right? So we are still in having those core issues, and we have to address those issues more importantly, so that women who are in the lower strata of the society are not left out. I think that is very, very important. And that this is the entire concept of like I'm a feminist and I think this is bad, that is bad. All that is actually, see, it's like I follow both feminist groups and men's rights groups. So I agree with some certain things in the feminist aspect, certain things with the men's rights aspect. But then like the thing is, I feel that people have to have the ability to discuss and tell that, okay, I am not supporting this particular opinion of yours. And that is normal, because that is how we work as a human species. That is how democracy works. Just because I have a idea which is against what your idea says doesn't mean that I'm a bad person. I'm just another human being who is existing and who is having an idea. That is it, right? So we need to make sure that we bring in people together, right? And that is exactly that's exactly why I want to start my podcast and my Instagram page. It's like my aim of having that is going to be to bring everyone together, not to create a war or not to like. So I try not to like, not to insult anyone or not to like tell this is bad, that is bad. And like if I feel certain things what a feminist page tells is bad, I will post that. if I feel something which is something what a men's right page is wrong, I'll post it and this is wrong. I think that is a way with which every one of us has to look at things. And once we start bringing everyone together, we will not have this problem at all. If we keep fighting each other, this is going to exist. I mean, like, there might be a possibility where like women start oppressing men. It's hypothetical, but then it can also happen. But then if that happens again, it's going to cause more problems. It's not going to solve the problem. It's going to cause, then men will start revolting against women. See, this is like, you need to balance everything. It's not like I am bigger and you are not, like you're short and stuff like that.
Okay, interesting. So the time flew really quick, and I have a lot more questions to ask you, Dr. Arvindh. But I think we'll wind up the session with one last question for the day. So body rights. So how aware body rights and legal rights? So what is actually the relationship between the two? Women in India, are women in India aware of their body rights? Like, for example, you said that marital rape and unwanted pregnancy and all that. So how is the awareness level of people in India regarding the decisions that they can take for their own body? What is your take on that aspect?
Yeah, so the awareness level is going to differ from one person to another. There's no question about it. So people who are getting more exposed to law and legal rights and getting exposed to education are going to be more aware of their rights. And that does not mean that the converse is not true. Okay, people who are suffering, because of their suffering, they might reach out and they might find that, okay, this is something which is wrong. Right. So that both extremes, both things can also be present. But what we need to understand is there's a very important and very dangerous component where women, in spite of knowing their rights, are either emotionally blackmailed or they themselves think they don't deserve that. Right. There are people who are in relationships which are toxic, which are horrible, but still continue to be in that because they think that they are not better enough for someone else. They're not better enough for something which is nice. I don't deserve this. And that is this thing which is more dangerous. I mean, like, you know that this is wrong. You know that I have that right, but then you still, like, end up being in an oppressed place. And that is actually what is wrong. And like, one more thing is the legal rights. We need to work on that a lot, because our like all the law, the IPC sections and all that stuff is like, it's actually quite old, and they keep updating it once in a while. One example I would like to tell is the recent amendment of the MTP Act, that is the Medical Termination Pregnancy Act, which happened in 2021. So that actually quotes that an abortion can be given to a woman. So that does not involve any trans people. Right. So any people who is someone who is a trans person who is pregnant, according to that act, cannot get an abortion. Right. So, or else they will have to accept that they are a woman and then get an abortion, something of that sort. Okay. But biologically speaking, only women can get pregnant. It's very difficult for a trans person to get pregnant. It's not going to happen because, like, there are too many hormonal influences and other stuff. But then if you are a trans person who have had a general shift surgery and you have had like that transition from a female to a male, and your hysterectomy, like, you have not been offered an hysterectomy, you still have a uterus and you still have ovaries, you can get pregnant. It is actually happened a few times in abroad, right? So there's a little bit of loopholes here and there, which I think we can work it out. I mean, like, India is actually quite progressive in a lot of aspects. Like, even though we tell that we are not progressive, it is the people but not the law. Legally, we have given a lot of thought to the rights of women, and I personally feel that especially the MTP Act, for what we have in India, is actually very progressive. And the MTP Act before 2021, which was actually first implemented in 1971, that by itself was very progressive for that time compared to all the other countries in the world. Like, compared to the US, compared to the UK, we had and we still have a very progressive abortion bill. Right. So I think it needs a little bit work, but then, like, we are getting there. I think we are in a better state, I think, for that particular matter.
So I hope this video reaches a lot of people so they actually look up, because people tend to look up for a lot of things. And awareness these days is majorly in the form of Google and other social media websites. So I hope they really look up to other judicial aspects of their basic body rights. And because this could phenomenally change a lot of people. Even in the most very rural places, people have access to internet and stuff. There is a lot of learning that is happening. So I actually hope videos of such kind and a podcast of yours where you have spoken a lot about judicial rights and body rights of women actually reach them. So thank you so much for being tonight, Dr. Arvindh. It was really a pleasure having you. I hope to, I look forward to seeing you in further subsequent sessions. So I would like to conclude by saying that, gynecologist, especially a specialty where people are hesitant to go to. I mean, not people rush to a general physician or to a surgeon or stuff. So you have actually made yourself accessible for people to reach to, which is a good thing. And I wish you best of luck in all your endeavors. So guys, I'll be attaching the link for Dr. Arvind's podcast and his social media websites in my video below. So do follow him for more updates on the general health and for well-being. So thank you so much, Dr.
Yeah,
Arvindh.
thank you so much for having me, Dr. Swetha. Thank you so much for having me. It's been a pleasure talking to you, and I look forward to having more sessions with you as well.
Thank you. Thank you, Dr. Arvindh.
Thank you so much. Yeah, thank you.
Yeah.